Hey guys, it's Luke here again with Patient Rush, and today I have with me Lisa Kane, who's from New England, and her company is Dental Office Compliance New England. Lisa, thanks a lot for coming on today. Appreciate it.
Hey, thank you so much for having me.
Cool, good to have you here. All right, so to kick us off, Lisa, if you could just give us a little bit of background on your story, how you got into the industry and how you got into the consultancy that you're doing now.
Yeah, so I'm a dentist. I practiced dentistry for about 20 years. And then I was getting really bad migraines, so I stopped practicing and started doing consulting. So I do infection control consulting. I go into offices and teach classes, but I also go in and help them with all the compliance stuff. So I, look around and see what they have, as far as, plans and protocols and, making sure they're following all the rules. Because I feel like there's a lot of, potential there to get in trouble, and I want to help protect offices. So I kind of moved in from the practicing to the, helping and organizing offices.
Nice, interesting. So do you find that a lot of offices are uncompliant? And what's the area incompliant?
So that's the problem. There's a lot of things that might not be related to dentistry and how well you're treating your patients. There's a lot of stuff that you need. There's a lot of written materials that you need. There's a lot of, you have to have your licenses posted in the front. Maybe people don't know that. There's things that are just, you have to have that. I practicing didn't pay attention to any of that. There's a lot of offices that don't have it or have really outdated stuff, have done stuff years ago, and, kind of think that that's carrying them forever, and it's not. So.
Right.
I definitely see a lot of room for improvement.
Yeah, nice. And by you coming in and helping them sort that out, they're able to. It's obviously it's a safety net for them, and it's make sure they're doing things right, and covers them in any way that they might be, doing things that they might come back and bite them, right?
Yeah, because right now, especially with COVID, people are scared. Patients are scared. Staff is scared. People don't seem to hesitate to be calling governing bodies like OSHA or the dental board. So I just want offices to be in the best position that they possibly can. Yeah. So if they can kind of have me come in or have somebody come in and, check everything out and make sure all their I's are dotted and T's are crossed, then if someone were to come in to evaluate their office, then hopefully, they would be in a much better position.
Yeah, I can imagine.
That's my goal.
More than ever, what you do is needed because, yeah, people are free. People are a lot more hesitant. Like a percentage of patients who would normally just come in now won't come in or need these assurances, don't they?
Yeah, and so many of the, the staff, they're so scared. I get calls every day. People are asking me, is it okay to do this with my PPE? Is it okay to do that? I do a lot of kind of talking people down. And then there's a lot, these past few months, or not few months, sorry, a few weeks, there's been people constantly calling me, telling me that somebody in their office was exposed to COVID. Someone's positive. Now what do we do? So it's a lot of, kind of helping people figure out, how to manage this and what's going on.
Yeah, interesting. So what's in terms of like what you're doing now, also when you were practicing yourself, what's a principle that you can share with the listeners that is something that's helped you in your career today?
I feel like research, I feel like keeping up to date with, the latest guidelines are always changing, and really understanding, each state in the United States is different. Each one has some you have to listen to the CDC guidelines, some you just sort of maybe have to listen. I do think keeping up to date with everything and trying to be really knowledgeable. So when you're practicing, so when a patient comes and asks you a question, you have the latest knowledge information. But, from my perspective too is, if someone in office asks me a question, I have the latest stuff because it's changing. All the stuff is changing every day. So I do feel like research and keeping up to date on, every day looking at all the websites and seeing what's changed, and then, trying to be as knowledgeable as possible about everything.
Yeah, absolutely.
What's going on.
So what are the places that you recommend people go to be able to get a concise sort of idea about the main things they need to be knowing?
Yeah, I mean, so the first thing I would always say is go to your dental board website. That, here in Massachusetts, that's kind of been, a little bit stagnant for a while because they're kind of deferring to the CDC and OSHA. But then I look up OSHA dental COVID every day, CDC dental COVID every day. I think that looking at those are really good. I think that the dental associations, like the American Dental Association, has some great resources, and there's links, and then there's OSAP that has a ton of infection control kind of related things. But just finding out anything that you possibly can, anything, how you get into like a rabbit hole, you click on one thing because there's some article about something and then it goes like 20 different places. So just spend some time on your computer every day. That's so wrong, right?
No, but I mean that's right. You gotta stay up to date because things are changing so fast now. So in relation to obviously what I was saying earlier, like what we do is what we talk about here a lot as well as marketing, and what would be the top sort of 2 or 3 things that come to mind for you around marketing in terms of compliance that you can share?
So I feel like, I am a person that never did social media. I don't even have my own Facebook account. I didn't do that. I was like so anti that. But that to me now seems like the best way to market yourself. And, there's all these groups, people are always, asking questions, and not a lot of people have the right answers. But I also think infection control wise, like I really try to tell my offices, like I happen to have this here, like I have, water tests, like do a water test, hold up your water test in your, social media picture and say, look at us, look how amazing our water is. Or do a lot of postings about infection control and do a lot of postings about how you just tested your airflow in your suction and it is amazing and the suction's amazing. So we're like so on top of this and we got you guys covered. I really feel like trying to promote how safe your office is, because honestly, as if I were, a patient that didn't know anything about an office, I think I would be attracted to that, and want to have a clean environment, especially now.
Yeah, nice.
So that's what I think.
Yeah. And what's a current challenge that yourself or your clients that you're noticing, like as of right now? I mean, aside from the obvious, like maybe dial it, a few levels down.
Yeah,
what's
yeah.
the challenge that you're seeing is consistent out in the market today for dentists that they're working through, that you're helping them work through, and how are you able to do that?
I think a couple of things, and I sort of mentioned them before. I think the people are scared, the staff is scared. So I think it's kind of working through that anxiety with people and getting them to do what they need to do. I think a big thing is, like as I was saying, keep up to date on stuff. I think there's a lot of people out there that are giving incorrect information.
Yeah.
Or answering things sounding like they know what they're talking about. I'm not saying I have all the answers, but kind of look at it for yourself. Like it's like I go into a lot of offices and they'll tell me one thing and then I'll just show them, okay, yes, thank you, but look, this is the exact like verbiage from the dental law that's telling me you something completely different. So I do think there's sort of that fight. I think that people are, I think that they're worried about their PPE. I think they don't have enough. They're all trying to, finagle some different way to use it. I think that just sort of, again, like really making sure that you're actually doing what you're supposed to be doing and not what your friend tells you you're supposed to be doing.
Yes. Yeah. So how does it look like when you go through with a new office? Like, can you sort of run us through how, like, what you recommend, or like on a high level, what are the things that sort of need to be in place to sort of be covered, and how you sort of work through that, just to give us an idea?
Yeah, so when I go through offices, I do them now virtually, a lot of them, which gives me sort of a bigger scope, which is nice. But, I check basic things, like OSHA has gotten over $3 million as of last week when I checked, from COVID violations. So one of the first things I check is to make sure that offices have fit tested, offices have a written program, people have had their medical clearance from their fit test, and they have that. They have an OSHA book, it's current. As I said, licenses out in the front. There always was supposed to be a cover your cough sign in the waiting room with hand sanitizer, tissues, a trash can, and mask. Like they're just kind of like low-hanging fruit things that if you have these, you're going to put anybody who comes into your office kind of in a more relaxed position rather than saying, what? You don't even have an emergency kit, or where's the eye wash? Oh, we don't have one. You know, and you know, stuff like that, maintaining the stuff they have, you know, testing their eye wash, checking their emergency kit, checking their oxygen tank, you know, spore testing, making sure they're spore testing whatever their state says they should spore testing.
Yeah.
You know, those are kind of like some really big ones. Labeling. I could just go on forever, but labeling, making sure you have biohazard sticker labels on everything that has a biohazard, and there's nothing in a container without a label. Otherwise, people, I've gone in offices and we've walked around and tried to figure out what things are because they don't have labels. It's kind of fun, but not helpful when you want to use that product.
Yeah, absolutely. And so when you work with someone, you go through these things, and then obviously there's just an implementation plan to get everything up to scratch. And is that sort of how it goes?
Yeah, so I go through, I spend some time and I go through at the office. Then I write a report and I go over it with them. And then they do a couple of different things. Like, you know, a lot of offices say, Lisa, here, go. You make all my plans and protocols, make them how they're supposed to be, and do them. You know, a lot of offices want to do them themselves. So if that's the case, you know, they already now have what they need to do. There's going to be stuff they're going to have to do themselves anyway, like the cover your cough sign or put up your licenses or order emergency supplies. But I do give them a pretty clear list of everything that they're missing, and we talk about it. And then they call me all the time to ask me questions.
Nice.
Which I kind of like.
Yeah.
I don't hear dogs, do you?
No, I can't hear any dogs.
No, okay, good.
Awesome. And so to wrap us up, Lisa, is there any other sort of parting advice, like from your, you know, your experience as a dentist or what you do now, that you want to share with the listeners?
Yeah, I just, you know, I love what I'm doing now, honestly, which is, you know, I love dentistry, but I honestly like this business aspect of it better. And I do think, you know, marketing your business is, you know, and word of mouth, but it's a really important thing. And I think that that's really, you know, I like to do podcasts. I like to, like, you know, do whatever, because I want to get out there and realize, you know, have people realize like how important these kinds of things are. But I think, you know, from your perspective too, I think that that's good.
Yeah, absolutely. No, I mean, people need to know about what you do, and that you can be trusted, and that you know what you're talking about. So any way to get out there is for you know, businesses like ourselves, or more specifically for dentists as well. It's the same thing, you know, like you can't just rely these days on your local community and them knowing about you, because there's more than likely a dentist within 3 kilometers who you're competing with, and if you're not they're explaining to people why you're different and better and why they should trust you and go with you, then you can't expect people just to know, you know. So you did right.
Yeah. And again, like, I think, you know, marketing about how great and following all the rules you are right now is so important, because patients are afraid to come. So, and staff, like, I feel like if you want really good staff and you want really good patients, like, that's a really good, you know, that's a good angle to take.
Yeah, for sure. Awesome. Oh, fantastic, Lisa. And so if anyone wants to reach out to you, where's the best place to find you, and how can they get in touch?
So my website is doc4ne.com. So doc and the number 4 and ne like New England.com. And they can just go on there and reach me. Fantastic. Or, you know, all the contact info is there.
Yeah, awesome. Oh, well, thank you so much, Lisa. I really appreciate your
Thank you.
And interesting conversation.
Great. Thank you so much.
Cheers.